Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everyone. Thanks again for tuning into another special edition of the Empowering Plans podcast on COVID-19. I am your host for today, Brady Bizzaro, and joining me today as my co-host is Senior Vice President Jen McCormick. Say hello, Jen.
Hello.
Hello, indeed. Well, wow. Here we are again, another podcast. We're in the middle of this pandemic crisis. There's so much news happening at a rapid-fire pace. We're getting consulting questions left and right about, workplace safety, about health benefit plan coverage. And I think what I've noticed, at least, Jen, in the media coverage, which I'm, as we all know, watching nonstop 24/7, is there's a lot more talk now that we've had a lot more people obviously being hospitalized and being treated for COVID-19. A lot more questions are being asked about the cost of this treatment, because that's going to result in a large bill for a lot of employees and a lot of plans as well. But before we talk about some of the projections on the cost of this treatment, why don't we just get a little reminder, Jen, about what plans currently have to cover under the federal laws that were just passed related to COVID-19. So can you fill us in on what is required now?
Sure. Yeah. And remember that there are two separate things when we're talking about what must be done on behalf of employees. There's the two categories. One is what the plan has to do, and one is what the employer has to do when it comes to leave bases. And what we're going to be focusing on when we're talking about the cost is specific to what the health plan is going to have to pay. So it took 3 iterations for us to kind of get here, but now we know as of today that there are certain things that the plan must require to be paid at 100%. So first of all, we know the testing. So any sort of testing, whether or not it's experimental and whatever phase that it might be in, that must be covered at 100%, no deductible, no copay, no co-insurance, whether it's in-network or out-of-network. So plans are going to have to cover that. The other thing that we know is that when it comes to the actual test, if and when there is some sort of vaccine that comes into play, the plans are also going to have to be required to cover that at 100%. So while that may not necessarily be today, maybe that's 12 months away, it's certainly something that plans should be careful of and be aware of for what they must cover in the future. But there are certain things that plans are not going to have to cover at 100%. And the scary things that people are talking about when it comes to what those costs could be, we're talking about those inpatient stays, we're talking potentially about some sort of drugs that might apply. And that can be concerning for people, particularly those who have a pretty high out-of-pocket or high deductible. So I think that's really some of the scary stuff that we need to worry about, or at least talk about.
And on that point, Jen, as it relates to the testing cost, I know we covered this on the webinar too, but remember that if you're a plan that's wondering about what the cost would be for an out-of-network provider who's administering this test, there are special rules in the CARES Act that require providers to post that price on a publicly available website, or else they could face a fine. So that's, and if they don't post the price, or I think there's a provision that allows for some negotiation as well on that price, but that's how the out-of-network side of the cost is projected. But more importantly, perhaps in terms of price, is the question of what is treatment cost. And we've got a ton of questions, especially because you've seen now a couple of fully insured carriers, large ones, Cigna is one of them, have come out and said that they will cover the cost of treatment with 0% cost sharing for the employees. So they'll basically cover it fully, which is something they don't have to do. And so we've been asked the question, have we seen self-funded plans do this? There's a lot of pressure, market pressure that is, for other insurers to potentially follow suit and do this. I'll note that for the large fully insured carriers, they are allowing their self-funded blocks of business to opt out of this. So they're not requiring them to cover treatment with no cost sharing. But we haven't seen, at the moment at least, a lot of self-funded plans decide to cover treatment with no cost sharing. That could cause some stop-loss issues and other downstream effects. But we've definitely seen the question asked more frequently, what do we expect costs could be? Are there any studies out there? We did cite one in the webinar, and this is one from Kaiser Health, from Peterson Kaiser Health. And the best data they looked at that's sort of analogous to the situation has to do with for inpatient treatment for pneumonia, where the length of stay in the hospital is about the same for COVID-19, and they estimate that on the low end, it could be about $12,000 up to $20,000, or I think 25,000 was the high. So the average cost, they say here, could be $20,000 per inpatient admission. And obviously, if a person is placed on a ventilator, that would result in a longer stay and a higher claim cost. But that was the best data we've seen so far for $20,000 per patient per admission. So to get some idea of what these costs could be, obviously that's, with complications, it could be a lot higher. So that's one thing that we've seen in one of the better studies.
And it's also important to consider the whole picture when you're talking about the cost of treatment, because there are lots of states, the majority of states now have stay-at-home orders. Massachusetts here, for example, in addition to having an order, we now have curfews and are supposed to be wearing some sort of protective gear over our faces when we go outside. So that means that if people are actually going to need the testing or they're going to need the actual treatment, maybe taking public transportation isn't the way to go. And maybe the way that they're going to actually need to seek those services is via an ambulance. So maybe when they get to the actual emergency room, because that's where they are transported, there's cost for the testing, and then they realize they need to be submitted inpatient, and then maybe there's some additional lab work that needs to be done. So we're not only talking about the cost of the actual inpatient stay, but there could be other lab services, emergency or ambulance services that need to be sort of factored into that as well. So it can quickly add up. Everything gets stacked.
Yeah, and look, as a result of all these questions about cost, people are asking the question, and sort of the elephant in the room that I think I see getting larger by the week. People are asking the question about, is employer insurance the best way to go, given how high these bills can be, given that we've seen, I think it's almost now 16 million people in the last 3 weeks have lost their job. And so we're aware of these articles that are out there, of news reports that people are questioning, is it the best time to have employer-sponsored health coverage as the primary way we cover people in this country? And I think the answer to that is still yes. There's some projections about, the estimated losses of coverage for people who had employer insurance. There was a study published that this Vox article that says between 12 million and 35 million people could lose their employer-sponsored health coverage due to this crisis. So a couple important points I wanted to make on that, and I know we'll probably have more to say about this in the next podcast. I know Ron has a lot of thoughts to add to this discussion, but I think it's fair to say that at least some of these jobs are coming back, right? So some of these people who've lost their coverage are going to regain coverage. So these numbers, I don't think they're as startling, or they look on paper to be startling, but I think we'll see a lot of these people will get their jobs back. Again, maybe not all, but a lot of them will. Secondly, I think in terms of the Medicare for All movement, I'm not so sure this is the best time to be pushing that theory, because hospitals are already under a lot of cost pressures and having revenue issues and cash flow issues. So the idea that you can have a single payer step in and sort of fix these problems by paying providers Medicare rates or something just above that, I don't think that's going to fix the problem any better, because you're going to have a lot of hospitals that still aren't being reimbursed enough to stay open. So we'll see how this discussion plays out, but we know that those articles are circulating online. We've seen them on social media as well. And it's a fair question, right? Again, if you assume all these people lost their jobs, a lot of them lost their coverage. And so it's fair to ask, what happens to those people? How does our industry respond to that? I think that's going to be part of the discussions we're going to have as an industry in the coming weeks and months from now.
Right. But let's not forget, one of the things that makes self-funding or employer insurance in general attractive is the ability to make changes and to be flexible and make modifications to a plan, whether you're allowing coverage even though you're laying people off to furlough them. You can make that with as soon as you can draft up the amendment and send it over for everyone to understand. And that's not something that otherwise could be done when you have a single payer system, where you are making those sort of protections or building in certain options that can protect the employees. And, that's one of the things that we're actually seeing a lot, and we're getting a ton of questions about, is that this is going to hit my business hard. I want to do everything that I possibly can to protect my employees. Please help me come up with something that's going to make the most sense, whether that's a furlough or temporary layoff or cutting hours, whatever the case is. People are trying to do whatever they can to make sure that their employees are staying protected and continuing to have that coverage that they need, which isn't something that otherwise may be an option.
Yeah, and I think, we'll have to wait and see how this plays out. And again, we're still, unfortunately, I think, kind of early on in this crisis. But as Jen noted, it's true also that a lot of plans have provisions for continuing coverage in the event of layoffs or furloughs. So maybe with a lot of the efforts at the federal level to help small businesses sort of get back on their feet, that they'll be able to have these employees return to work before their coverage lapses on some of these continuation of coverage provision issues. So we'll see if how things play out. I think it's too early to say, but I just want everyone to know that we're aware of the discussions that are out there. I think they're unfair. And again, in our industry in particular, like Jen mentioned, we have the agility, the flexibility to show that employers really care about their employees and their benefits. And a lot of them are doing all they can to keep them on their plans. And I think you will see, like you've seen in the fully insured space, I think you will see a lot of self-funded plans try and cover more of the cost of treatment of COVID-19, because we've also heard from stop-loss carriers that are willing to work with plans that do that as well. So I think all those things will play out in time. But for now, we're aware of it. We're keeping track of developments. And as we get them, we'll bring them to you. And I think that's probably a good place to pause for now. We'll have more thoughts on this certainly in the next podcast. But on behalf of myself and Jen McCormick and our amazing remote producer, Pat the Man Santos, I want to thank you all for tuning in. Talk to you next time.